Prof. Teo, although the total numbers are high, if we look only at the cases in the community, the number has been coming down. So has the circuit breaker actually been working? And why is there a need to extend it?
So if we look at the data affecting the community, it is indeed true that we see that the numbers from before the circuit breaker up until yesterday, the numbers in the community actually dropped. And we see this very clearly when in the beginning of the circuit breaker, the 3-day average was around 48. And yesterday, the past 3 days, it was around 5. So based on those numbers, we know that the circuit breaker is effective. But is it giving us the effect outcome that we're hoping for at this stage, about 15, 16 days post implementation of the circuit breaker? That is the part that I am actually a bit disappointed that the numbers have not fallen as low as we were expecting. And this really points to the presence of some leakages that's happening in the community, whether it is amongst people who are supposed to be staying home, but yet they have been venturing out without taking the necessary precautions, or it could be some of the essential workers that are still out there working, and they are the ones getting infected. And we have seen in over the past 4 days evidence that suggests that some of the workers in the essential sectors are getting infected. And this is the reason why there is a need to perhaps step up the circuit breaker measures to now limit the definition of what is essential services and to further restrict the essential sectors a bit more.
Right. I can understand greater restrictions, but then there is no restriction on people exercising without masks. And you notice along the East Coast, etc., you get crowds of people running, jogging, walking. Is that a place where the virus could leak?
At the moment, based on some of the information that I've seen, there is no clear evidence to suggest that it is at East Coast Park that people are at exercise, whether it is parks or whether it is in your neighborhood gardens that people are getting the infection from. Right now, the majority of the trends for the infections outside the community still points to workplaces and perhaps some household transmission. There are still some unlinked cases that we don't know about, and this is really the reason why there is a greater degree of restriction now on some of the park connectors, on some of the beaches as well. So we really have to understand where the unlinked cases are coming from, and then to put in place the necessary measures to really try to drive this down.
Right. Now, as I mentioned earlier, we are only 2 weeks into the current phase of the circuit breakers. And incubation generally is 5 to 7 days, or it could be longer. So the people who are coming up as new cases now could have been infected prior to the circuit breaker, except maybe for the last 2 days. So then the question is, was the Prime Minister jumping the gun? Could he not have waited maybe another week, or would it not have made a difference? Yisin, maybe you could take that?
Well, I think I will approach it in this way. In many ways, I do agree with YY's point in terms of the disappointment we have at this point in time. We have not seen a satisfactory drop in the local transmissions. But if you were to look at the entire world, Singapore is not a unique example that we have imposed a circuit breaker. China obviously has done so, and many other parts of the world. And if you were to look at the degree of decline of the number of cases, you then realize that 2 weeks is not a period that will be adequately able to reduce the number of cases. And then you look around that many of the other countries that had imposed lockdown of the cities or the entire countries are now extending the period of lockdown. And it's important for us to understand as the reason why. The reason why is basically this is a very smart virus, like what Dale had just mentioned. It will find ways to remain in the human populations and try to find a way that it can transmit and continue to stay with us. So it's not something, it's a simple virus for us to deal with. It has human-to-human transmissions. It can transmit when we are not aware, And I do agree that at this point in time, 2 weeks definitely not enough. How long should we extend? I think it is better for us to use this period to inculcate into us the behavior. Because if we don't change our behavior, it's no longer how long your circuit breaker is going to be. Because once we bounce back into our old normal self, the virus is going to come back. So I think those are the important things we just have to bear in mind.